Hey, Alpha Nurses, I'm Licensure from alphanursguide.com. This is 10 practice NCLEX questions. Without delay, let's get started.
A client is receiving streptomycin in the treatment regimen of tuberculosis. The nurse should assess for 1. Decreased serum creatinine. 2. Difficulty swallowing. 3. Hearing loss. 4. IV infiltration. The correct answer is 3. Streptomycin can cause toxicity to the 8th cranial nerve, which is responsible for hearing, balance, and body position sense. Nephrotoxicity is a side effect that would be indicated with an increase in creatinine. Streptomycin is given via intramuscular injection. When teaching a client with heart failure about preventing complications and future hospitalizations, which problem stated by the client as reasons to call a physician would indicate to the nurse that the client has understood the teaching. Select all that apply. 1. Becoming increasingly short of breath at rest. 2. Weight gain of 2 pounds or more in 1 day. 3. High intake of sodium for breakfast. 4. Having to sleep sitting up in a reclining chair. 5. Weight loss of 2 pounds in 1 day. The correct answers are 1, 2, and 4. If the client will call the physician when there is increasing shortness of breath, weight gain over 2 pounds in 1 day, and need to sleep sitting up, this indicates an understanding of the teaching, because these signs and symptoms suggest worsening of the client's heart failure. Although the client will most likely be placed on a sodium-restricted diet, the client would not need to notify the physician if he or she had consumed a high-sodium breakfast. Instead, the client would need to be alert for possible signs and symptoms of worsening heart failure and work to reduce sodium intake for the rest of that day and in the future. One of the important aspects of the client's rights is the right to treatment in the least restrictive environment. The nurse observes this principle when making which decisions. Select all that apply. 1. Referring a client to a group home or supervised apartment living. 2. Releasing client information to a primary care physician or a relative. 3. Placing a client in seclusion or restraints. 4. Respecting the client's right to accept or refuse treatment. 5. Placing a committed client in a daily outpatient group or a weekly self-help group. The correct answers are 1, 3, and 5. Group homes, apartment programs, seclusion, restraints, day treatment programs, and self-help groups all involve degrees of restriction and supervision. Releasing information about the client is governed by legislation and rules of confidentiality. Accepting or refusing treatment is governed by laws related to informed consent. A client with heart failure is receiving digoxin intravenously. The nurse should determine the effectiveness of the drug by assessing which of the following: 1. Dilated coronary arteries. 2. Increased myocardial contractility. 3. Decreased cardiac arrhythmias. 4. Decreased electrical conductivity in the heart. The correct answer is 2. Digoxin is a cardiac glycoside with positive inotropic activity. This inotropic activity causes increased strength of myocardial contractions and thereby increases output of blood from the left ventricle. Digoxin does not dilate coronary arteries. Although digoxin can be used to treat arrhythmias and does decrease the electrical conductivity of the myocardium, these are not primary reasons for its use in clients with heart failure and pulmonary edema. The nurse is teaching a client who has been diagnosed with tuberculosis how to avoid spreading the disease to family members, which statement indicate that the client has understood the nurse's instructions. Select all that apply. 1. I will need to dispose of my old clothing when I return home. 2. I should always cover my mouth and nose when sneezing. 3. It is important that I isolate myself from family when possible. 4. I should use paper tissues to cough in and dispose of them promptly. 5. I can use regular plates and utensils whenever I eat. The correct answers are 2, 4, 5. When teaching the client how to avoid the transmission of tubercle bacilli, it is important for the client to understand that the organism is transmitted by droplet infection. Therefore, covering the mouth and nose when sneezing, using paper tissues to cough in with prompt disposal, and using regular plates and utensils indicate that the client has understood the nurse's instructions about preventing the spread of airborne droplets. It is not essential to discard clothing, nor does the client need to be isolated from family members. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. When instructing clients on how to decrease the risk of chronic obstructive pulmonary disease, the nurse should emphasize which of the following: 1. Participate regularly in aerobic exercises. 2. Maintain a high-protein diet. 3. Avoid exposure to people with known respiratory infections. 4. Abstain from cigarette smoking. The correct answer is 4. Cigarette smoking is the primary cause of COPD. Other risk factors include exposure to environmental pollutants and chronic asthma. Participating in an aerobic exercise program, although beneficial, will not decrease the risk of COPD. Insufficient protein intake and exposure to people with respiratory infections do not increase the risk of COPD. A client has returned from the cardiac catheterization laboratory after a balloon valvuloplasty for mitral stenosis. Which of the following requires immediate nursing action? 1. A low, grade 1 intensity mitral regurgitation murmur. 2. SpO2 is 94% on 2 liters of oxygen via nasal cannula. 3. The client has become more somnolent. 4. Urine output has decreased from 60 milliliters per hour to 40 milliliters over the last hour. The correct answer is 3. A complication of balloon valvuloplasty is emboli resulting in a stroke. The client's increased drowsiness should be evaluated. Some degree of mitral regurgitation is common after the procedure. The oxygen status and urine output should be monitored closely, but do not warrant concern. When teaching the parents of a child with ventricular septal defect who is scheduled for a cardiac catheterization, the nurse explains that this procedure involves the use of which of the following: 1. Ultra-high frequency sound waves. 2. Catheter placed in the right femoral vein. 3. Cut-down procedure to place a catheter. 4. General anesthesia. The correct answer is 2. In children, cardiac catheterization usually involves a right-sided approach because septal defects permit entry into the left side of the heart. The catheter is usually inserted into the femoral vein through a percutaneous puncture. Echocardiography involves the use of ultra-high frequency sound waves. A cut-down procedure is rarely used. The catheterization is usually performed under local, not general, anesthesia with sedation. The nurse is planning to teach a client with chronic obstructive pulmonary disease how to cough effectively. Which of the following instructions should be included? 1. Take a deep abdominal breath, bend forward, and cough 3 or 4 times on exhalation. 2. Lie flat on the back, splint the thorax, take 2 deep breaths, and cough. 3. Take several rapid, shallow breaths, and then cough forcefully. 4. Assume a side-lying position, extend the arm over the head, and alternate deep breathing with coughing. The correct answer is 1. The goal of effective coughing is to conserve energy, facilitate removal of secretions, and minimize airway collapse. The client should assume a sitting position with feet on the floor if possible. The client should bend forward slightly and, using pursed lip breathing, exhale. After resuming an upright position, the client should use abdominal breathing to slowly and deeply inhale. After repeating this process 3 or 4 times, the client should take a deep abdominal breath, bend forward, and cough 3 or 4 times upon exhalation. Lying flat does not enhance lung expansion. Sitting upright promotes full expansion of thorax. Shallow breathing does not facilitate removal of secretions, and forceful coughing promotes collapse of airways. A side-lying position does not allow for adequate chest expansion to promote deep breathing. The most effective measure the nurse can use to prevent wound infection when changing a client's dressing after coronary artery bypass surgery is to: 1. Observe careful hand washing procedures. 2. Clean the incisional area with an antiseptic. 3. Use pre-packaged sterile dressings to cover the incision. 4. Place soil dressings in a waterproof bag before disposing of them. The correct answer is 1. Many factors help prevent wound infections, including washing hands carefully, using sterile pre-packaged supplies and equipment, cleaning the incisional area well, and disposing of soil dressings properly. However, most authorities say that the single most effective measure in preventing wound infections is to wash the hands carefully before and after changing dressings. Careful hand washing is also important in reducing other infections often acquired in hospitals, such as urinary tract and respiratory tract infections. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.